Hey, Alpha Nurses, I'm Licensure from alphanurseguide.com. This is 12 practice NCLEX questions. Without delay, let's get started.
While caring for a prima gravida client with class 2 heart disease at 28 weeks gestation, the nurse would instruct the client to contact her primary healthcare provider immediately if the client experiences which of the following: 1. Mild ankle edema. 2. Emotional stress on the job. 3. Weight gain of 1 pound in 1 week. 4. Increased dyspnea at rest. The correct answer is 4. Increased dyspnea at rest must be reported immediately because it may be indicative of increasing congestive heart failure. Mild ankle edema in the 3rd trimester is a common finding. However, generalized or pitting edema, suggesting increasing congestive heart failure, must be reported immediately. Emotional stress on the job increases cardiac demand. However, it needs to be reported only if the client experiences symptoms, such as palpitations or irregular heart rate, indicating heart failure related to the increased stress. Weight gain of 1 pound per week is a normal finding during the 3rd trimester. After instruction of a prima gravida client at 8 weeks gestation diagnosed with class 1 heart disease about self-care during pregnancy, which of the following client statements would indicate the need for additional teaching? 1. I should avoid being near people who have a cold. 2. I may be given antibiotics during my pregnancy. 3. I should reduce my intake of protein in my diet. 4. I should limit my salt intake at meals. The correct answer is 3. The client needs a diet that is adequate in protein and calories to prevent anemia, which can place additional strain on the cardiac system, further compromising the client's cardiac status. The client should avoid contact with people who have infections because of the increased risk for developing endocarditis. The client may need antibiotics during the pregnancy to prevent endocarditis. Limiting sodium intake can help to prevent excessive expansion of blood volume and decrease cardiac workload. With plans to breastfeed her neonate, a pregnant client with insulin-dependent diabetes asks the nurse about insulin needs during the postpartum period. Which of the following statements about postpartum insulin requirements for breastfeeding mothers should the nurse include in the explanation? 1. They fall significantly in the immediate postpartum period. 2. They remain the same as during the labor process. 3. They usually increase in the immediate postpartum period. 4. They need constant adjustment during the first 24 hours. The correct answer is 1. Insulin needs fall significantly for the first 24 hours postpartum because the client has usually been on nothing by mouth status for a period of time during labor, and the labor process has used maternal glycogen stores. If the client breastfeeds, lower blood glucose levels decrease the insulin requirements. With insulin resistance gone, the client commonly needs little or no insulin during the immediate postpartum period. Although the need for insulin decreases during the interpartum period, the insulin requirements fall further during the first 24 hours postpartum. After the first 24 hours postpartum, insulin requirements may fluctuate markedly, needing adjustment during the next few days as the mother's body returns to a non-pregnant state. A prima gravida client with diabetes at 39 weeks gestation is seen in a high-risk clinic. The primary healthcare provider estimates that the fetus weighs at least 4,500 grams. The client asks, what causes the baby to be so large? The nurse's response is based on the understanding that fetal macrosomia is usually related to which of the following? 1. Family history of large infants. 2. Fetal anomalies. 3. Maternal hyperglycemia. 4. Maternal hypertension. The correct answer is 3. Maternal hyperglycemia and poor control of the mother's diabetes mellitus have been implicated in fetal macrosomia. When the mother is hyperglycemic, large amount of amino acids, free fatty acids, and glucose are transferred to the fetus. Although maternal insulin does not cross the placenta, the fetal pancreas responds by hypertrophy of the islet cells of the pancreas. The islet cells produce large amounts of insulin, which acts as a growth hormone. A family history of large infants usually is not the reason for large for gestational age fetuses in diabetic mothers. Maternal hypertension is associated with small for gestational age fetuses because of vasoconstriction of the maternal and placental blood vessels. At 38 weeks gestation, a prima gravida client with poorly controlled diabetes and severe preeclampsia is admitted for cesarean birth. The nurse explains to the client that childbirth helps to prevent which of the following? 1. Neonatal hyperbilirubinemia. 2. Congenital anomalies. 3. Perinatal asphyxia. 4. Stillbirth. The correct answer is 4. Stillbirths caused by placental insufficiency occur with increased frequency in women with diabetes and severe preeclampsia. Clients with poorly controlled diabetes may experience unanticipated stillbirth as a result of premature aging of the placenta. Therefore, labor is commonly induced in these clients before term. If induction of labor fails, a cesarean section is necessary. Induction and cesarean section do not prevent neonatal hyperbilirubinemia, congenital anomalies, or perinatal asphyxia. After teaching a diabetic prima gravida about symptoms of hyperglycemia and hypoglycemia, the nurse determines that the client understands the instruction when she says that hyperglycemia may be manifested by which of the following? 1. Dehydration. 2. Pallor. 3. Sweating. 4. Nervousness. The correct answer is 1. Dehydration, polyuria, fatigue, flushed hot skin, dry mouth, and drowsiness are manifestations of hyperglycemia. Hyperglycemia is a medical emergency and requires immediate action to prevent maternal and fetal mortality. Pallor, sweating, and nervousness are early signs of hypoglycemia, not hyperglycemia. When teaching a prima gravida client with diabetes about common causes of hyperglycemia during pregnancy, which of the following would the nurse include? 1. Fetal macrosomia. 2. Obesity before conception. 3. Maternal infection. 4. Pregnancy-induced hypertension. The correct answer is 3. Maternal infection is the most common cause of maternal hyperglycemia and can lead to ketoacidosis, coma, and death. The client should notify the primary healthcare provider immediately if she experiences symptoms of an infection. Fetal macrosomia, obesity before conception, and pregnancy-induced hypertension are not associated with maternal hyperglycemia during pregnancy. When developing a teaching plan for a prima gravida client with insulin-dependent diabetes about monitoring blood glucose control and insulin dosages at home, which of the following would the nurse expect to include as a desired target range for blood glucose levels? 1. 40 to 60 milligrams per deciliter between 2 o'clock and 4 p.m. 2. 70 to 100 milligrams per deciliter before meals and bedtime snacks. 3. 110 to 140 milligrams per deciliter before meals and bedtime snacks. 4. 140 to 160 milligrams per deciliter 1 hour after meals. The correct answer is 2. The goal is to maintain blood plasma glucose levels at 70 to 100 milligrams per deciliter before meals and bedtime snacks. Below 60 milligrams per deciliter indicates hypoglycemia. A range of 110 to 140 milligrams per deciliter suggests hyperglycemia. The target range 1 hour after meals is 100 to 120 milligrams per deciliter. The nurse explains the complications of pregnancy that occur with diabetes to a prima gravida client at 10 weeks gestation who has a 5-year history of insulin-dependent diabetes. Which of the following, if stated by the client as a complication, indicates the need for additional teaching? 1. Candida albicans infection. 2. Twin-to-twin transfer. 3. Polyhydramnios. 4. Preeclampsia. The correct answer is 2. Clients who are pregnant and have diabetes are not at greater risk for multi-fetal pregnancy and subsequent twin-to-twin transfer unless they have undergone fertility treatments. The pregnant diabetic client is at higher risk for complications such as infection, polyhydramnios, ketoacidosis, and preeclampsia compared with a pregnant non-diabetic client. A 30-year-old multigravida client at 8 weeks gestation has a history of insulin-dependent diabetes. Since age 20, When explaining about the importance of blood glucose control during pregnancy, the nurse should tell the client that which of the following will occur regarding the client's insulin needs during the first trimester. 1. They will increase. 2. They will decrease. 3. They will remain constant. 4. They will be unpredictable. The correct answer is 2. During the first trimester, it is not unusual for insulin needs to decrease, commonly as a result of nausea and vomiting. Progressive insulin resistance is characteristic of pregnancy, particularly in the second half of pregnancy. It is not unusual for insulin needs to increase by as much as 4 times the non-pregnant dose after about the 24th week of gestation. This resistance is caused by the production of human placental lactogen, also called human chorionic somatotropin, by the placenta and by other hormones, such as estrogen and progesterone, which are insulin antagonists. Which of the following statements about a fetal biophysical profile would be incorporated into the teaching plan for a prima gravida client with insulin-dependent diabetes? 1. It determines fetal lung maturity. 2. It is non-invasive using real-time ultrasound. 3. It will correlate with the newborn's APGAR score. 4. It requires the client to have an empty bladder. The correct answer is 2. The fetal biophysical profile, a non-invasive test using real-time ultrasound, assesses 5 parameters: fetal heart rate reactivity, fetal breathing movements, gross fetal body movements, fetal tone, and amniotic fluid volume. Fetal heart rate reactivity is determined by a non-stress test. The other 4 parameters are determined by ultrasound scanning. The results are available as soon as the test is completed and interpreted. The lecithin-sphingomyelin ratio is used to determine fetal lung maturity. Although the fetal biophysical profile is useful in predicting which fetuses may be at greater risk for compromise, there is no correlation with the newborn's APGAR score. The biophysical score is sometimes referred to as the fetal APGAR score. A score of 8 to 10 indicates fetal well-being. Use of an ultrasound requires the mother to have a full bladder. A prima gravida client with insulin-dependent diabetes tells a nurse that the contraction stress test performed earlier in the day was suspicious. The nurse interprets this test result as indicating that the fetal heart rate pattern showed which of the following? 1. Frequent late decelerations. 2. Decreased fetal movement. 3. Inconsistent late decelerations. 4. Lack of fetal movement. The correct answer is 3. A contraction stress test is used to evaluate fetal well-being during a simulated labor. A suspicious contraction stress test indicates inconsistent late deceleration patterns requiring further evaluation. A negative contraction stress test indicates no late decelerations and is a desired outcome. A positive contraction stress test indicates fetal compromise with frequent late decelerations. Fetal movements are one of the parameters of biophysical profile and are detected with non-stress testing. Decreased or absent fetal movements may indicate central nervous system dysfunction or prematurity. Lack of fetal movement or decreased fetal movement is not associated with contraction stress testing.
You can get my NCLEX review bundle. Links will be in the description. I'll see you guys in the next video.